We will talk about early signs of diabetes. We have classical diagnosis of diabetes is increased blood glucose level. Blood glucose level in the morning should be more than 126 milligram deciliter to diagnose diabetes mellitus. But we have early symptoms before diagnosis diabetes, and we will discuss these early symptoms. First is increased thirst. Why increased thirst happens? It's classical and most important symptom of early symptom of diabetes, and it happens because when we have high blood glucose level, our body tries to dissolve this glucose in the blood, and from our tissues fluid comes drawn from tissues to blood, and it causes tissue dehydration. So even we intake enough water, our tissues still dehydrated because fluid moves from tissue to blood, and it causes feeling thirsty. That's why increased thirsty and intake water is first and classical symptom of diabetes. When person increase in taking water, we have second step. It increases urination also because our kidneys start to more blood, it filters this blood, and urination is increased. Also, our body tries to flush out glucose from body, and that's why kidney excretion is increased, and we have increased urination. And when we have increased urination, it increases dehydration and person is more thirsty. So we have this cycle, this logical cycle: increased thirst and increased urination. And we have third symptom, it's also classical symptom, is increased appetite. Why we have increased appetite? Because our primary source of energy is glucose in normal cases. And when we have increased blood glucose level, but we can't utilize this glucose because of lack of insulin or ineffective action of insulin, we have glucose but we can't utilize it. It causes energy deprivation of cells, and when no energy to cells, we feel hungry because cells feel hungry, and we have sense of hungry, and a person starts eating more and increase appetite, but still no energy. That's also classical symptom of diabetes. And this triad is known also as polydipsia, polyuria, and polyphagia. It's from classical Latin, and it means increased thirst, increased urination, increased appetite. And newly diagnosed patients of diabetes mellitus, 90% of such patients have first two symptoms, polydipsia or polyuria. And if we ask which is most common symptom out of these three, it's increased thirst. It's first symptom of diabetes and most important symptom. Also, maybe person says instead of increased thirst, he says that I have dry mouth. Dry mouth also means increased thirst. Fourth symptom is velvety patches on skin. It is called Acanthosis nigricans, which is common in armpits, groin, neck, and underarms. You can see this velvety patch of skin, discoloration of skin, and it's also very common symptom. It's early symptom. It affects around 70% of patients with diabetes. And why it happens? it happens because insulin level is increased. It's compensatory increase of insulin level. When insulin level is increased, insulin-like growth factor also increase, and both of these hormones causes stimulation of cell growth on skin, and it is caused this discoloration, patchy growth of cells, and it is called acanthosis nigricans. Fifth symptom is unexplained weight loss. Unexplained weight loss means that person eats a lot but he still weight loss. Why it happens? Because during diabetes, as we said, we have high blood glucose level, but our body can't utilize this glucose. Our cells still deprive energy, and body tries to find solution. And solution is switch primary sources of energy from glucose to proteins and fat burning. And body starts to burn proteins and fats. It means that it burns our adipose tissue or our fats, and it burns also our muscles. That's why person starts weight loss, and it's unexplained, because he will say that I'm eating a lot but still weight loss. That's a classical sign of uncontrolled diabetes. It's more common in case of type 1 diabetes, but also it's common for type 2 diabetes when diabetes is uncontrolled. And many people who are diagnosed diabetes, they will say that before I was diagnosed, I weight lost, for example, 10 kilograms or 20 kilograms. And sixth and most earliest symptom of diabetes is blurred vision. Why it happens? Because, as we said, high blood glucose level causes drawn fluids from cells and tissues towards bloodstream, towards blood, to dissolve this glucose, and also fluid drawn from lens, from our eyes towards bloodstream, and it causes blurred vision. And at this case, this blurred vision is temporary only when blood glucose level is increased, and when blood glucose levels will stabilized, then person sees normally. But when blood glucose level is high, person has blurred vision. As the disease progresses, when diabetes is progressed, then blood vision can be constant when high blood glucose level is constant. Its earliest symptom, even no other measurements show changes, this symptom can be first. That's why we should pay attention. Blurred vision. Of course, it's not diabetic retinopathy. Maybe you think that it's retinal damage of eye. It's not correct. Diabetic retinopathy is complication of diabetes. It's another condition. This blurred vision is dehydration of our eye. That's different. It's temporary, and this is early symptom of diabetes. And seventh symptom is feeling fatigue. Even person eats a lot, even person drinks lots of fluids, he still feels tired, because fats are deprived energy, and fat and cells still feel hungry and lack of energy. That's why person has sense of tiredness and fatigue. It's also classical for uncontrolled diabetes. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.